The respiratory system. Look at all those objectives. What does the respiratory system do? Delivers air to the lungs that then allows for the blood to be oxygenated and delivered to the cells. Also rids the body of waste products like carbon dioxide and helps us to talk by forcing air through the larynx. The system is divided into an upper and lower tract. The upper tract or airway is the first organs that the air will move through, so the nose, mouth, pharynx, epiglottis, larynx, and trachea. The lower tract consists of the bronchial tree and the lungs. Other structures of the respiratory system include the nose, which includes the nasal septum. A septum is a wall, and this wall is in between the nostrils. There are small hairs in the nose, which all of us are familiar with. Mucous membranes line the nostrils and produce mucus that help to trap foreign bodies before they enter our systems. See how all the systems interact and overlap with each other? Olfactory receptors are the nerve endings in the nose that are responsible for smell. The tonsils are also part of the respiratory system. Tonsils are at the back of the mouth, and adenoids are tonsils that are behind the nose and roof of the mouth. They are also part of the lymph system. Sinuses are also a part of the respiratory system. They are air pockets that make the skull lighter. They help to make sound and lubricate the nasal cavity. There are frontal sinuses above the eyebrows, sphenoid that are located behind the eye, maxillary under the eyes in the maxillary bone, and ethmoid between the nose and the eyes in the ethmoid bone. The pharynx is the throat and is divided into three sections. The nasopharynx. Naso is nose, so associated with the nose and used to transport air. Oro, think oral, means associated with the mouth. The oropharynx is part of both the respiratory and digestive systems because you eat and breathe through your mouth, right? More overlapping. Laryngopharynx is also shared. The larynx is the voice box that's located between the pharynx and the trachea. 9 cartilages help to support it. The vocal cords are contained in the larynx. They are protective mechanisms in place to prevent choking. The soft palate prevents food and liquid from going into the nose, and the epiglottis prevents the same from going into your lungs. The trachea brings air to and from the lungs. It's right in front of the esophagus and held open by rings of cartilage. The bronchi are divided into 2 large tubes that branch off of the trachea. There is a right and a left. They funnel the air from the trachea to the lungs. They divide into smaller and smaller airways, and the smallest airway branch are the bronchioles. At the end of the bronchioles are the alveoli. This is where the gas exchange occurs. Oxygen is delivered and carbon dioxide is picked up to bring back to the lungs for oxygenation via the blood system. Each lung has millions of alveoli. They are lined with a substance called surfactant that makes the alveoli stay open. The lungs are the primary organ of the respiratory system. The right lung is divided into 3 lobes and is slightly larger. The left lung has 2 lobes. The mediastinum is the middle of the chest cavity and in between the lungs. Within the mediastinum is the heart, trachea, esophagus, bronchi, thymus, and lymph nodes. The pleura is the membrane that surrounds the lungs and lines the thoracic cavity. There are 2 layers. The outer layer is the parietal layer. This is the layer that lines the thoracic cavity. The visceral pleura covers the lungs. There's a thin space in between the two layers called the pleural space or cavity. It's filled with fluid so that as the lungs move with breathing, they don't rub against anything in the thoracic cavity. The diaphragm is the large muscle below the lungs that's responsible for breathing. When you inhale, it contracts, pulling down and allowing the lungs to expand and fill with air. When you breathe out, it relaxes, letting the air out of the lungs. It also separates the thoracic cavity from the abdominal cavity. The phrenic nerve stimulates the diaphragm, causing the contraction and relaxation. What doesn't the respiratory system do? Good Lord, if you don't get this right, we are in trouble. Digest, that's a whole other system. Respiration is breathing. Inhalation, we already talked about when the diaphragm contracts, pulling air into the lungs, and exhalation when the diaphragm relaxes and the air flows out. External respiration is what we think of as breathing, exchanging oxygen for carbon dioxide in the lungs. Internal respiration occurs at the cellular level. This diagram shows you the level at which external versus internal respiration occurs. External is here at the organ level, and internal is here at the cellular level. We just talked about the difference between internal and external respiration. External respiration is at the organ or lung level, and internal is at the cellular level. Here are some medical specialties associated with the respiratory system. They utilize several of the root words associated with organs, as well as the root of pulm. Which one diagnoses head and neck problems? Which one has head and neck organs listed in the name? Otolaryngologist. So otolaryngologist. ENT doctor. Diseases of the respiratory system include COPD or chronic obstructive pulmonary disease. This diagnosis is actually a group of diseases where airflow out is obstructed. The two most common conditions are chronic bronchitis, which is what? Bronch is bronchi. Itis is inflammation, so inflammation of the bronchi. Also common is emphysema, which is progressive loss of lung function. Other common disorders are asthma, which is an inflammatory disease of the bronchi. This is generally triggered by an irritant or allergen. Sudden and severe reactions are attacks when you have wheezing and difficulty breathing. Inflammation triggers mucus production, which makes the structures of the respiratory system gunky and plugged up. Bronchospasm is just what it says. Your bronchi spasm or contract, causing difficulty breathing and uncontrolled coughing. You can have exercise-induced asthma that is associated with exercise only. This shows you what happens when you're having an asthma attack. See how much smaller that tube is and how it's filled with mucus, so it's so much more difficult to get that air through that tube. Upper respiratory disease is just that, affects the upper respiratory system, like the nose and pharynx and larynx. Things like colds and allergies are examples of common upper respiratory disorders. Most of the disorders are associated with inflammation. What is the suffix for inflammation? Itis. So rhinitis, Rhine is nose, so inflammation of the mucous membranes in the nose causing rhinorrhea because rhea is excessive flow, so runny nose. Laryngo is larynx, so laryngitis is inflammation of the larynx. Pharyngo is pharynx, so pharyngitis is inflammation of the pharynx. Croup is inflammation of the upper respiratory system that is usually sudden and due to an infection. The barking or seal bark cough is classic. Epistaxis is a fancy word for nosebleed. Impress your friends and family next time anyone has a bloody nose. The RSV and the flu virus, the pertussis bacteria, and many other varieties of the common cold virus can cause bronchitis, bronchiolitis, that's mostly RSV, rhinorrhea, or sinusitis. We already talked about pharyngitis and laryngitis. Laryngospasm is the same as bronchospasm. Instead, we are talking about the larynx. See how if you break down the words, you can just switch out the parts of the words. And if you know what the parts mean, you can figure out what the words mean. Voice disorders are A means without. So aphonia is without sound. Dys is dysfunctional. So dysphonia is dysfunctional sound. We talked about bronchitis earlier when we talked about COPD. There is acute, which means sudden, which is like a chest cold. Bronchiectasis is caused by chronic infection or inflammation like with COPD that causes permanent damage to the walls of the bronchi. Bronchorrhea is what? Rhea is excessive abnormal flow. So excessive abnormal flow of mucus from the bronchi. Diseases of the pleural cavity are pleurisy, which is an inflammation of the pleura, which can also be called pleuritis. Exactly. Dynia is pain. So pleurodynia is pain that originates from the pleural, generally with pleuritis. Pleural effusion is fluid accumulation within the pleural space. It makes it hard to breathe because the lungs can't expand as freely. Other disorders of the pleural cavity are pyothorax. So pyo is pus in the pleural cavity. Empyema is a collection of pus anywhere in the body. Hemothorax is what? Hemo is blood and thorax is chest, so collection of blood in the chest. Pneumo is lung or air and thorax is chest, so accumulation of air in the chest like from a collapsed lung. ARDS is acute respiratory distress syndrome where there's inflammation in the lungs causing increased fluid in the alveoli, so there is no gas exchange. Atelectasis is a collapsed lung, and granuloma is a tumor, and pulmonary edema is fluid in the lung tissue. A pulmonary embolism is a clot that causes sudden blockage in the pulmonary vasculature or circulation. TB is a bacteria that predominantly affects the lungs, but really can be found anywhere in the body. Pneumonia, I have never seen it abbreviated like this in the past 40 years that I've been a nurse, is inflammation of the lungs that causes the passages to fill with pus and fluid. Pneumo is lung, and EA is an abnormal condition. You can have bronchopneumonia or lobar pneumonia. If you have double pneumonia, it's affecting both your lungs, so double the fun. Generally, pneumonias are referred to by the cause of the disorder, like viral pneumonia caused by a virus, or aspiration pneumonia caused by aspirating or inhaling a foreign subject or object like vomit. A type of interstitial lung disease is cystic fibrosis. but it is really a group of diseases that causes inflammation and scarring of the alveoli. It can be a genetic cause like in cystic fibrosis or an environmental cause like asbestosis. And here's what happens when you smoke and those damaged cells become cancer cells. This is a very important list. These words describe breathing. Very important in conveying to others what is going on with your patients and for you to understand what you're being told about your patient. So, apnea means breathing. So let's use those prefixes. U is normal, so eupnea is normal breathing. A is without, so apnea is without breathing. Brady is slow, so bradypnea is slow breathing. Tachy is fast, so tachypnea is rapid or fast breathing. Cheyne-Stokes is this irregular, shallow breathing pattern, oftentimes just before death in a patient. These are the visuals of those breathing patterns. Sleep apnea is also a breathing disorder where you stop breathing during sleep and eventually returns, but it's associated with other diseases like cardiovascular disease. Coughing is coughing, and hemoptysis is coughing up blood or bloody mucus. So hemo is blood, and tysis is spitting, so spitting blood. A lack of oxygen can be due to choking when the air can't get in or out. A is without, ox is oxygen, and Ea is abnormal, so abnormal condition without oxygen. Hypo is below, so an abnormal condition of low levels of oxygen. And carbon monoxide poisoning can lead to hypoxia or anoxia. Cyanosis is a lack of oxygen. Cyan is blue. That's the printer cartridge that you need to replace, right? Osis is another suffix for abnormal condition. So when you don't have enough oxygen, you turn blue. Hypercapnia is excessive amount of CO2. Hypoxemia is low, hypo, levels of oxygen in the blood. This is different than hypoxia. Respiratory failure or respiratory acidosis. So respirations aren't doing the job, so low oxygen and high CO2 levels. For pediatrics, there is sudden infant death syndrome, unknown cause between the ages of 1 month to 1 year. This is why we position our newborns on their side instead of their backs or stomachs. Which one is part of the respiratory system? Broncho, yes. Laryngo, yes. Pharyngo, yes. So what's the answer? All of them, correct. How do we diagnose? We listen and observe by counting the respiratory rate and listening with a stethoscope. We can look at organs directly by using a scope via bronchoscopy or laryngoscopy. We can use X-ray or MRI. We can use pulmonary function tests or sleep studies to diagnose sleep apnea. There are those devices we put on our fingers to measure the percentage of oxygen in the blood, called an oximeter. We can send secretions to the lab for pathology and culture. For those of us in healthcare already, we get yearly testing for TB. Which procedure do we use to diagnose lung pathology? Chest X-ray, yes. Here are common medications we use. Cough medicine is called an antitussive. So fancy. Decongestants, expectorants, all things we buy over the counter when we have colds. Bronchodilators, medications that dilate or make larger the what? Bronchi, exactly. Like albuterol. You can use it as an inhaler or through a nebulizer with compressed air. This is someone using their inhaler and where the medications reach. There are various surgeries used to treat, as well as intubation, where a breathing tube is inserted into the trachea to keep your airway open. Tracheostomy bypasses the nose and throat and creates an opening in the neck. Surgery can be performed to remove all or part of the lung, either partially with a wedge resection or lobectomy, or a whole lung called a pneumonectomy. Thoracentesis is a puncture into the chest wall with a needle to extract fluid out. Otomy is to create an incision or an opening. So thoracotomy is an incision into the chest wall for a biopsy or treatment. VATS is where video is used to assist in thoracic surgery. Different equipment is used to help the respiratory system function. A CPAP or BiPAP machine both provide positive pressure into the respiratory system to prevent the airway from collapsing. An ambu bag is the bag you see used during CPR with a healthcare professional. Ventilator is the machine that performs respiration for the patient who is incapacitated. Other treatments are the use of oxygen or a hyperbaric chamber, which is pure oxygen under very high air pressure. How do you spell good breathing? What means good? Brady means slow. A means without. UO is not a thing. So what does that leave? Eupnea. U means normal. Good, so eupnea. Common abbreviations are listed here and in Table 8.1 of your e-text. What does CF mean? I mean in medical terms, right? I use it all the time and not for medical terms. Cystic fibrosis. What belongs to the lower respiratory tract? Right, the bronchial tree and lungs. Everything from the bronchi and below is the lower respiratory tract.